Right. So if you have read and understood, considering its surgical and administration, kindly tell me what are the compartments of the leg?
There are three compartments: interior compartment, superficial, posterior, and deep compartment, and superficial, deep, and
Think
posterior
again.
compartment,
Yes.
and lateral compartment.
Then how many compartments it
Three
becomes?
compartments. Three
Are you
compartments.
sure? How many
Yes,
compartments there are in the back?
two compartments, superficial and deep.
So they're all together four, right?
Okay, four.
Can you name the muscles of each compartment?
Yes, the anterior compartment contains tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius, while the lateral compartments contain peroneus longus and peroneus brevis. And the superficial posterior compartment contains gastrocnemius, soleus, and plantaris. Deep contains popliteus, flexor hallucis longus, flexor digitalis longus, and tibialis posterior.
Okay. What are the nerves of the leg?
Nerve anterior compartment
Yes.
is supplied by deep peroneal nerve, and
Which is branch
lateral
of? Which is branch of?
which is a branch of sciatic nerve.
Okay. Then other, please tell me quickly.
And then the lateral compartment from superficial peroneal nerve, and the posterior compartment by tibial nerve.
Okay. Can you please tell me what are the structures which pass behind the medial malleolus, if you can tell?
Structures pass behind the medial malleolus are tibialis, structures pass behind the medial malleolus. I remember.
That's all right. No stress.
I remember that.
There is a mnemonic. People don't like it, but maybe you can tell Tom. Dick and yes.
Tom does. Oh, wait. Tibialis posterior. Does flexor digitorum longus. Tibial vessels and nerve. Posterior tibial vessels and nerve. And flexor hallucis longus.
Okay, can you please tell me what are the bones which form the contour of the leg?
Bone which form the
contour of the leg. Bones, I say. What are the bones which form the contour of the leg? How are they?
Tibia.
Yes.
Tibia and fibula.
Yes. How are they placed?
How are they placed?
Yes. Are they connected with anything, or is there anything else in between, or they're just there?
No, there is
in between them.
Yeah, there's a tendon between them. Fish.
Are you sure?
Not the tendon. It's a fascia, more like a
yes.
Septum, more like a septum.
Okay, which is connected in between them. Can you tell me the direction of that septum, or whatever you're calling? How is it? Is it attached from tibia to fibula, or from fibula to tibia? Does it go downwards and laterally, or upwards and medially? If you can tell me.
This fascia goes downward and laterally from tibia to fibula.
Okay, so can you tell me, if a patient comes with an injury right? Then how would you confirm if it is which compartment which is involved? How would you confirm the compartment syndrome? How would you come to the diagnosis of compartment syndrome?
The diagnosis of the compartment syndrome on the clinical basis of pain,
Yes.
pain out of proportion,
Yes.
then pulselessness, then swelling,
Yes.
then pallor,
Yes.
then and then we can confirm it by ABPI, but that's not required. Basically, that's a clinical diagnosis.
Yes, but then how would you confirm which compartment is involved? See, you told me yourself there are 3 or 4 compartments of the leg. Which compartment has the, which compartment is involved? How would you examine, even if you'll do the clinical examination, how would you confirm? Is it posterior compartment? Is it anterior compartment? How would you conclude?
I don't know.
You'll ask the patient to do
I'll
the dorsiflexion or plantarflexion or
passive movement on the passive
yes,
movement.
yes, but then how? If patient has a pain on passive movement, what would your conclusion be? Is it like anterior compartment? Which is yes, yes, nothing.
When the patient plantar flex, then
Yes.
then this will be then the pain will be on the plantar flexion. Then the if there is a pain, then the compartment is of the posterior side, and if the dorsiflexion, then the anterior compartment.
Okay, can you please, one simple question, tell me the dermatomes and the myotomes of the lower limb?
Dermatomes and the myotomes are L1, L2, how do I, L1, L2, and L3 are the anterior side of the thigh, and then L4 on the medial side of the lower leg, and L5 on the lateral side, and then S1 of towards the lateral side of the foot, and we have posterior side of the leg, and S2 over
can you look at the right hand side image and tell me if you can identify structure A to D? This one, right hand side image. If you can tell me what A is, and then B, C, and D. You can have help of your friends because time is gone. That's all right. They can help you if they want.
Okay. This is
what kind of image is it?
It's an angiogram.
Okay, of which vessel?
Femoral.
We're discussing leg. What is
Sorry?
the, we're discussing leg?
Popliteal.
Yes, popliteal. So if you can tell me, if just suppose A is the popliteal artery, then what might be the B?
Peroneal.
No. Anterior. Tibial.
Anterior tibial.
Yes.
Posterior tibial.
Which one is posterior now?
This
C or D?
C.
Okay, good. And then what is D?
D will be anterior, posterior, and
Peroneal.
Peroneal.
Okay, good. Would you be able to identify on the left hand side picture, in the left hand side image or picture, structure A?
Patellar tendon or tibial tuberosity.
Yes, it's something.
Not clear though.
Yes. Okay, B, please.
B is it's muscle basically, and
It's white, so it should be something else. Okay, we'll discuss. Okay, what is C?
C is medial malleolus.
Good. Okay, medial or lateral. Okay, what is D?
D is a tendon of tibialis posterior.
Okay. So what are the nerves of the legs? You told me once. We'll just ask again.
Nerve
Of the legs.
of the legs are anterior tibial nerve, posterior tibial nerve, and I don't know. I confused everything.
Don't. Just don't take stress. All right.